So we have a 30-year-old patient. She's a homemaker by occupation and is a resident of New Delhi. She has come to the surgery OPD with the complaints of swelling in front of the neck for the last 4 months. The patient was apparently well 4 months ago when she first noticed swelling in front of the neck while looking in her mirror. This swelling was insidious in onset and has gradually progressed over the course of the last 4 months to the present size, is not associated with any pain. She also gives a history of excessive sweating of her palms for the last 4 months. There's history of weight loss despite increased appetite. The weight loss has not been quantified, but she reports it as a loosening of her clothes. She does not have any history of palpitations, mood swings, irritability, or restlessness. There's no history of altered bowel habit. There's no history of vision problems like double vision or blurring of vision. She does not give any history of involuntary movement of limbs. There are no other swellings in the neck. There's no history of difficulty breathing, change in voice, or difficulty swallowing. There is no history for a cough, blood and sputum, abdominal pain, jaundice, backache, or any bony pains.
Can we stop here?
Yeah, sure, sir.
How did you take a history of mood swings?
So just by asking whether she feels low or like.
Will anybody admit that I'm not feeling too good? Or I'm too excited? Or I'm too depressed? You know, few things are not asked from the patient. They are asked from the family members or the people who live with her.
Yes, sir.
They will describe how has been a change in the behavior of the patient. There's irritability, restlessness, mood swings. They are not asked from a patient. Number two, how do you take a history of involuntary movements?
What I'm trying to ask here, sir, is for the tremors.
Shall I ask you a simple question? What's the definition of tremor?
So it's a movement of the limb which may be intentional.
No, that's not the definition of tremor, scientific definition of tremor. How will a patient tell you whether she has an involuntary movement or
not? She could report it in terms of a tremor that she feels when she's attempting to do an activity, or when she's sitting still, she notices that the fingers are moving.
No, that doesn't happen in thyroid. When you are at rest, your hands don't move. That's a neurological disorder. That's not a thyroid disorder. You know, these are few things which I don't know, I've been pointing out regularly for the last so many years. These are the things a patient may not volunteer, or you may ask, have you noticed that you can't hold a glass of water? Or do you tend to fall on one side when it is a truncal movement? Has the child noticed or the parents noticed the handwriting has deteriorated? Or ask a patient to write in front of you and see whether he or she can hold a pen or not. So these are things which, in a way, it gives the impression that maybe, I know you're not appearing in any exam or anything at all, that maybe you have been told the diagnosis of a patient. And that's something which is not a good impression an examiner would like to have. If that is the impression an examiner has, unfortunately, the candidate's fate is almost sealed. I shouldn't say that, but that's true. Then why did you ask a history of abdominal pain, jaundice, or backache?
So all the points in this last bullet point are to rule out metastasis in case of a malignancy.
But in cases of carcinoma thyroid, metastasis beyond the neck is extremely late. A 30-year-old lady with a goiter can't have a metastatic carcinoma, or if at all, it is anaplastic, it would manifest with neck symptoms rather than metastatic symptoms in the spinal metastasis or other metastasis. It's extremely uncommon. It's a very late manifestation. Similarly, blood in sputum is not a common thing. I don't recall having seen maybe an odd case in the lifetime that I have spent with the patients. Abdominal pain, not a feature of carcinoma thyroid. Jaundice is extremely rare. If at all it occurs in Graves' disease or following medical therapy. So let's be a little careful and precise when we are taking a history from a patient. Weight loss, again, how did you ask a history of weight loss from her?
So she was not able to tell in terms of the kilograms that she's lost, but she does report that she has, she visibly feels that she's lost weight and her clothes have loosened.
Yeah, that is what is important. As she noticed that the clothes that she could wear 6 months earlier, they hang on her.
Not this lady did not describe it in terms of hanging, rather than that they are loose now.
Okay. Go ahead.
So I wanted to ask, like here, like we know that this is not the common metastatic sites. So should we skip this part in a long case also?
Yes, at the age of 30, if you suspect a neoplastic lesion of the thyroid, it has to be one of the papillary or follicular. Papillary 80%, follicular maybe 15 to 20%. Papillary rarely metastasize into bones. 9 out of 10, or maybe 98 out of 100 is a nodal metastasis or pulmonary metastasis. Bony metastases are extremely rare. I recall only maybe one case who also had metastasis in the cranial cavity. Otherwise, the bony metastases from papillary carcinoma are extremely uncommon.
Yes, sir.
So one need not ask these things unless you are questioned directly. You don't have to say that. A 60-year-old person coming with a thyroid swelling, yes, you may ask, is this suggestive of metastasis? But a 30-year-old young lady, no, it's very uncommon.
Yes, sir.
Go ahead.
She does not have any history of any chronic medical illness like diabetes, hypertension, asthma, tuberculosis. There's no history of malignancy in the past. She has also not had any surgeries.